All right, everyone, good morning. My name is Scott Darius, and I'm the Executive Director of Florida Voices for Health. Twice. So this panel, as we've talked a lot about it, right? The PHE, and we say that a lot. And I think sometimes we just kind of assume that everyone is in the circle, like everyone's been on these calls frantically with us for the last few months and kind of understands where we're coming from. But I think it's worth just kind of setting the stage for the conversation. We know that in 2020, right, we hit a pandemic, a public health emergency, and one was officially declared. And as part of that declaration, states were given additional funding to keep people enrolled in their Medicaid programs and weren't allowed to, in exchange for that additional funding, weren't allowed to disenroll people. So what they call the continuous coverage provision. In the last few months, we've seen the public health emergency itself end, but there was also, at one point, kind of a decoupling between that continuous coverage provision and the public health emergency. Long way to say that states are now able to disenroll people from their programs. Right now, Florida is currently going through that process of redetermining the eligibility status of those 4 or 5 million Floridians who are currently enrolled in the program. And as we've gone through that process, I think there were a lot of concerns from advocates, and now we're seeing some of those things play out. So I think the goal of this conversation is to really get a better sense of what's happening on the ground. We're so fortunate to be joined by a couple of experts, but people with firsthand knowledge of how this has been playing out in these early days. The redetermination process started in April, and so now we're really starting to get our arms around what's happening out there. One last thing I'll say before we truly kick off. We have our partners from the Florida Healthy Kids Corporation who are also tabling outside, and they have a couple of toolkits, informational toolkits, to get back out to community members to help us message correctly about what's happening. Our partners back here in the back. Gina, let me give people a wave. There we go. Awesome. So, yeah, I think our partners also have some other resources and things like that to share, but we'll dive right in. I'm so thrilled to be joined by Jafet Rios from True Health and FQHC. We have Katie Roders-Turner from the Family Healthcare Foundation, and they are navigators and help people enroll in coverage. And we have Allison Yeager from the Florida Health Justice Project, who's one of our great policy analyst partners, but also legal assistants, and really helping people as they have to navigate the system. And actually, we'll start off with Allison as we kick off. Kind of another ground level setting piece. If you could tell us a little bit about the work that your organization does, but also kind of what the state had its own plan for redetermination and how they're going to take on such a big task. Wondering if you can help us kind of just, get a sense of what that plan was before we get to the part where we talk about how it's going.
So, good morning everyone, it's great to be with you. So quickly, Florida Health Justice Project, we are an advocacy organization. We also provide lots of technical assistance to folks and create and disseminate community education materials. So we have been preparing for this unwind at a fairly frantic pace for well over a year now. We have an unwind page on our website that is loaded with materials, FAQs, Q&As, videos aimed at both healthcare consumers as well as social service providers and healthcare providers. Sorry, is that better? Yeah, okay. And so we are, it's a lot of echo. We are really hoping that folks can access those materials, put them to use. A lot of them are directed at frontline staff, so if you are in an organization where you have people who are directly interacting with members of the public, check out our training videos, check out our flyers, keep them on your front desk. That's really what they're there for. We also have waiting room flyers. So please, it's floridahealthjustice.org, and then it's our continuous coverage unwind page. And we are also, as Scott mentioned, a resource if you are working with individuals who have been disenrolled and believe that they have been improperly terminated.
We are here to help them figure out how to file an appeal and pursue all due procedure rights and ensure that their process was proper. As to the state's plan, so we held, a bunch of us held a convening in Tampa at the end of January, where Patty Grogan from DCF joined us and gave a really thorough presentation about what the state's plan looked like. And I will give a shout out to some of these folks at DCF who have been themselves working incredibly hard. It's a monumental task that they are presented with, and they are understaffed and under-resourced, and they are really taking on a Herculean effort. So what they shared with us at that time was they do have, they've beefed up their communications strategy to really try and get the message out far and wide. They did that they are doing that through direct communications, through digital communications, and through working with all of us partners. We are definitely an important mouthpiece for them. They've beefed up their technology so that they've enhanced their capacity to auto-review eligibility so that fewer people actually have to go through the process of redetermination, and they rely on their databases more to determine themselves whether someone may remain eligible in a different category if they lose eligibility in the category in which they're currently enrolled. They've created some systems for looking at returned mail and trying to find ways to connect with people whose mail was returned. They created a chat bot on their website, and I will say, some of us got a training in how to use that chat bot. It's like a little virtual assistant that pops up in the bottom right corner of the My Access page, and that is actually a very functional tool and works well. So if you're working with clients or patients and trying to help them update their information, know that that chatbot is a good place to start. As to the mail, another thing that we should all be aware of is that the letters from DCF are coming with a yellow stripe on them. So that's kind of their way of flagging, this is important mail. Whether that's successful or not, I'm not sure, but let people know that they should be looking out for envelopes with a yellow stripe. The last thing I'll say is just in terms of their prioritization timeline that they shared with us. The first sort of tranche of people who they are redetermining are those folks who they understand based on the most recent information that they've gotten from them are no longer eligible and have not used their Medicaid benefits in the last 12 months. I will say, we know that that's not going according to plan. We've seen already deviations from that prioritization. But so, since I was asked to channel the state, that's the plan we heard from the state back in January.
But I think it's a really good segue to our next batch of questions, and I'll just go ahead and combine them. For Katie and Jafet, it'd be great for folks to know the work that you do, how you interact with Medicaid enrollees typically, and then I think it's worth just diving into the question of, have you seen, right, because our big concern is that people who are eligible for Medicaid will and are being kicked off of the program. So if you can tell us a little bit about how you interact with Medicaid enrollees, but also have you seen that first kind of concern come to fruition at all?
Thank you so much. And thanks, Scott, to everyone here and to Florida Voices for Health for this summit today. It's an incredible opportunity to be together with an amazing room of people who are all focused on these issues that impact Florida. So, Family Healthcare Foundation, real quick, we're a nonprofit. We've been around for 25 years. We're in the Tampa Bay area. And we help people with publicly funded healthcare programs like the Health Insurance Marketplace, Florida Kid Care, Florida Medicaid, and we're really fortunate to be in a part of Florida that has some amazing safety net programs like the Hillsborough County Healthcare Plan, which is a safety net program that's totally no cost for Hillsborough County residents. And so for the people that we serve, it's everyone and anyone who needs access to healthcare coverage. Right now, and most recently, we see new retirees who aren't eligible for Medicare, the chronic or acutely homeless, pregnant mothers, children, really anyone will screen for whatever program they're going to qualify for and then help them get into those programs. And then in regards to the recent terminations, specifically around the procedural terminations for people who are eligible for Medicaid, we are seeing it. And we saw that, there were reports that came out most recently from CMS last week that show this terrifyingly high number of disenrollments due to procedural reasons, and we are seeing that in the communities that we serve. And despite DSF's communication plan, which when the plan was available, it was really comprehensive and we were excited to see it. From the family's perspective, many of them were not anticipating this, and the communications are coming, they're overwhelming sometimes for families. In addition to that, with the additional layer of now the managed care plan outreach, increasing the communication to families, there's just this another wave that we're seeing a little bit of confusion. So that's from where we sit.
Right. Well, good morning, everyone. Can you all hear me well?
Yes.
I feel like if I hold the mic, I have to go in song mode at some point. Well, my name is Jose Rios. I serve as Regional Director of Operations for True Health. True Health is a federally qualified health center here in Central Florida. We have
Sing it.
I did. I love it. Shout out. We provide services to over 48,000 patients throughout Central Florida, and that includes Orange, Seminole, and Volusia County as well. We do many services, including adult pediatric care, podiatry, x-ray, behavioral health, and our insurance enrollment team. They are a combination of certified application counselors, navigators, and community outreach specialists, and they're sitting right at that table over there. They are on the front lines every single day, helping folks who are arriving to our clinics every day, finding out that they are no longer a Medicaid beneficiary right at that moment. And when you think about it, that's such an impact. For us as an organization, about 20 to 30% of our patients are 100% or below the federal poverty level. So having a reduced access to coverage, what does that mean? It means less money to pay your bills, less access to specialty care, less healthcare utilizations, and unfortunately, more unfavorable healthcare outcomes. So as an organization, what we're doing is we are, one, utilizing the resources that we have as an organization to continue providing high quality care to all, regardless of their circumstances. And then two, we're partnering with different community-based organizations in our region just to make sure that we can further our reach and help folks get through this redetermination process as well. So, thank you.
And Allison, I know you guys are also seeing, you're having folks reach out to you because they're running into terminations. What's that been like?
We are absolutely seeing people who
Were terminated wrongly. Like I mentioned earlier, folks who were not supposed to be in that first wave of redeterminations and were. Some folks here may have seen a story in one of the papers about a mother who, she and her child who has leukemia lost their benefits. Clearly that was a family relying daily on their Medicaid. So we've seen folks coming to us who are getting all sorts of confusing notices. I will say that the notices that are coming from the state are exceptionally challenging to understand, even for healthcare attorneys. They're sort of inherently confusing, and so it's hard to know what to make of them, which for many people means they don't know what next steps to take. And you have a brief window in which to appeal if you believe that you were wrongly terminated. So if you don't understand from the very language of the letter that you were terminated and you missed that brief window, then you're starting all over again. For all those folks who were procedurally terminated, the folks that Katie and Hafet mentioned and what that means is, it's not that you are no longer eligible, it's that they sent you a request for information and you didn't get that letter or you missed that mail, and so you didn't respond, and so the window just closes and your case is closed. You could still in fact be eligible. So we're all seeing a lot of those. We know that, like Katie mentioned, the state's data last month showed that of those folks who were terminated, 80% of those terminations were due to procedural reasons. So we know that there are significant challenges with people not getting their mail, people not knowing to look out for that yellow stripe. So many people have moved in the last 3 years because of turbulent economic conditions and housing, crazy housing market. So folks are not necessarily readily contacted. And despite the fact that there was supposed to be this robust public communications plan, I was driving in Miami last week and saw for the first time a bus with a sign on the side that said, update your information and targeting the unwind. But we're in May, late May. This has been something that we've all been anticipating for many, many months. So folks, like Hafet said, are surprised. They aren't prepared for this. And so we're seeing many people who are getting the termination notice for the first time, not having known that they had to put in that updated information, et cetera.
Yeah, and I'm so happy you mentioned the kind of the confusing language that we see from DCF and some of their notices. And so I'm wondering, Katie and Hafet, are you seeing that? Has that also been your experience? And how have you been helping folks navigate the application process? Are you doing the nitty-gritty with them? And I guess kind of as a follow-up to that question, so I'm just going to stack them all together. What's your communication been like with DCF? If, as part of the help you're providing with applications, if you're reaching out at all to DCF and what that communication feedback loop has been like?
So I will say, in terms of the letters that are received, in many cases, our team struggles to understand those letters, and we have been doing this work for the past 13 years. So if we as subject matter experts are barely understanding these letters at times, imagine someone who is a new Medicaid beneficiary and have no idea what that letter means. So what we've done as an organization is, one, we walk through the process with them. Once they arrive to our health center with that letter with the yellow stripe, we try our best to understand that letter, right? We log into the My Access account, see what is their current account standing, and provide guidance from there as well.
Okay. I was taking notes, so I knew what to talk about. So first and foremost, I want to kind of echo something that did at the beginning, which is acknowledge all of the staff that are doing this work as families come to them. So I want to acknowledge that we've got Family Healthcare Foundation navigators in the room, and I'm so proud of them because I frequently am asked to be the voice of the work that they're doing every single day, and I know that they are the ones who are meeting families more so often than I am. And families they're really confused. Many of the families that we assist, English is not their first language. They're not familiar with the U.S. healthcare system. They're not only afraid of their coverage terminating, but the coverage of their children. And as a parent of 2 children myself, I cannot imagine how terrifying that might be. So that is a big part of the work that they've been doing, more so often now than in years past, understanding the letters that they're receiving from the Department of Children and Families, not only having to translate them as far as languages go, but in understanding the complexities of what those letters are actually saying. I think what's been the most challenging in the last few weeks is that for families who have completed the applications, they've gone and they've submitted and done the work they needed to do to keep their coverage or transition to the correct programs. They're continuing to get generic messaging that is causing continued panic. And I think that's creating a lot more stress on families. It's also creating a burden for the workforce that we have available as they're duplicating efforts of things they've already done. In addition to that, for the feedback loop with DCF, I've been really pleased with what we've sent over to them in regards to the virtual chat. That's been one of our favorite tools that we've used since they launched that. at a point when I had another community partner asking me about, there was a nuance that they felt like it wasn't working, I got a response back from DCF when I had a good contact within 2 days. So I feel like there's efforts being made. Like Allison said, this is a Herculean effort that they've not had to go through before. And I know that they're working as hard as they can with the resources they have. And then in addition to that, Florida Healthy Kids has also been an amazing partner in this. In regards to the child who was in remission from leukemia, we actually were assigned that case as a follow-up after the ABC Action News article came out, highlighting that family. And we were able to help them get to Florida Healthy Kids even faster, and they were able to get their coverage secured, which was an amazing outcome for that family at a really scary time. So those, that's been our perspective most recently.
If I may add something, well, I agree with Katie wholeheartedly. Florida Healthy Kids has been an amazing partner to us. So I'm glad to see Gina and Gabby in the room. We've been working closely with them since 2018, and they're really a key partner in us being able to reach out into the communities as well. I do want to highlight the language barrier. So 50% of our patient population are Hispanic/Latino. What does that mean? Many of them have limited English proficiency. So even though the letters are arriving in Spanish, the translation at times doesn't even make sense. So, so fortunately, we have a plurality of our staff that are bilingual speakers and are able to provide them assistance. But again, that creates an undue burden on a Medicaid beneficiary as well.
And Allison, have you guys been working or reaching out or talking to DCF at all?
We have, so we're collecting trends that the partners across the state are seeing, and we're periodically sharing them with DCF by email, by phone. We know that they are frankly a little overwhelmed right now, and I think they're hearing from a lot of us about the systems challenges that we're observing, and I think they're working to correct some of them. Some are more readily remediated than others. I think certain things like the language of the notices, honestly, I don't understand. Their computer system is a dinosaur. And so for whatever reason, it's incredibly challenging for them to change the language in these notices. It's not like someone can just go into a computer and change some words and out come the new notices. And I will say to the prior panel's conversation about the importance of budget being a values reflection, the state has not given the agency the funds that it needed, which we all knew well over a year ago would be required to take on this massive task. And so they're still working with systems that are really outdated and quite honestly not up to the task. So there are some things that they are able to respond to quickly, and other things that their machinery is just not well equipped to handle.
Yeah, and I want to circle back to something Hafez said, but real quickly, you mentioned the idea of trends versus, I think, this idea of like specific instances, like people with specific issues. Are you seeing a difference in how those are playing out when you communicate with DCF or whoever's there to help? Like, are they responding to trends more versus specific episodes?
We have seen some instances where they have been able to correct misdeterminations on behalf of individuals fairly readily, although we did have one case recently where the high up at DCF informed us that the case that things were changed and corrected in the system, and then when the person went back to her provider, the provider still said, no, your Medicaid is terminated. So there's clearly some disconnection between the high-ups and what's happening on the ground. And then, I think the systems things are often longer-term solutions that require more resources and more sort of concerted teamwork on behalf of the DCF folks. Like, if they need to bring in their comms people or their IT people, that's a big task. That doesn't happen overnight.
And I think we'll open it up for questions. So if folks have any questions that they want to ask, just raise your hand and our mic runners will get to you. But in the meantime, I wanted to circle back to something Hafez said, right? Thinking about folks with limited English proficiency, that feels like one group that maybe is at real great risk of falling through the cracks. So I wonder if that's like the main one, or if there are other groups that you're seeing as you're doing this work who yeah, are at higher risk of losing their Medicaid eligibility or coverage.
So, previously, the previous panel brought up SB 1718 with the new immigration changes. So I think the overlay of the immigration legislation combined with the Medicaid redeterminations is a huge undertaking in itself, is going to create a real, what we saw before, a chilling effect with families not only who are supposed to be responding to letters to keep their Medicaid coverage for their kids who are eligible for coverage, but are terrified of all the immigration changes that are coming right now. And so I'm really concerned about the population of those with mixed status households for immigration statuses, and potentially an amplification of loss of coverage based on those changes that we're seeing.
No, I agree completely. Even as an organization, I can only say so much as it relates to SB 1718. But what I can say is we serve folks who are undocumented immigrants, and the concern is that they are now less likely to come see us. And that is a chilling effect all in its own. But so yes, I wanted to add that as well.
And I'll just add, as I said earlier, people have moved a lot. We know that folks who are receiving Medicaid are typically among our most marginalized, disenfranchised residents. And so the pandemic has caused all kinds of turbulence for so many of us. But that may have hit the Medicaid population especially hard. And so if you've moved multiple times in the last 3 years, the chances that you're gonna be able to keep up with your mail are that much harder. And, when you've got all kinds of other constraints on your time, it doesn't necessarily feel like a priority to be logging into your My Access account and updating your information. And then the next thing you know, you walk into a vet's clinic and your Medicaid's been terminated.
Yeah, that's a really good point. Take one in the back and then.
So my name's Nicole Sutton, and I serve on the Parents Oral Health Advisory Committee. And so I'm here today because actually not only am I a Med Committee, but I'm also one of the individuals, myself and my son, were Medicaid enrolled, and we were featured with the Florida Health Justice Project for the Medicaid expansion, and also that we were able to retain our coverage during the emergency, but we're one of the families that is likely going to lose coverage. And with that, I want to acknowledge Katie, my healthcare advisor, or healthcare navigator is with you folks. It's Melissa Escalante, and she has been incredible over the last few years in helping us be able to make sure what our status is. So I just want to give both of you a lot of respect for the way that you've engaged the community and folks like myself and my son. With that said, I just want to bring attention to one thing that was really confusing for us as we've been going through the process of trying to find out if we're losing coverage, and that's the connection between the child support program and Medicaid. So basically, I'm a violence survivor, and I have not wanted to engage in the process of pursuing the person who assaulted me in order to keep health insurance for myself and my son. In order to keep that coverage, I've had to do that. And so, interestingly, through the process of trying to recertify, I was contacted again by the Child Support Office and asked to update all of my information again, including where I live. And so, I just want to bring that up because I think that there's a real issue, that it's an injustice to folks, that you have to disclose where you are. There's limited protections. And basically, it's my son that ultimately suffers because it's possible that he would not be able to get coverage.
Can I respond to that? So first of all, thank you so much for sharing your story with us, and for all of when folks take that brave step of putting their voices out there into the world, there's no greater form of advocacy than that. And I can tell you, we are getting calls and emails and text messages from media constantly who want to be reporting on this story, which is great. The world needs to know what's happening, but they want to do it with the face of folks who are experiencing it. And so folks who are coming forward and saying, I want to tell my story, that is a gift to all Floridians.
I also want to say we've been talking to the state about the child support issue, and thank you again for raising that in specific. We know it's highly problematic, and we've gotten some indication from them that they're thinking about something along those lines. I don't have any details, but they are hearing these issues, and we will continue to raise it. So I'm really glad you raised it here. And if other folks who are, connected to the DV community and have an inroad with DCF can also be raising it, I think it's really important that they hear that from so many issues, because it is hugely problematic.
Thank you for that.
And just to say thank you so much for sharing that story, and I cannot tell you enough about how much that must mean to Melissa as well, so we're gonna be sure to share that with her. Thank you.
Awesome. Thank you so much, Nicole. Karen, you have the mic.
Thank you. Thank you all for all that you're doing on this. And my policy advocacy brain goes off when you hear these discussions, because just like people coming forward with their stories for the media and for them to be told, it is incredibly important and powerful if folks would contact their legislators with their issues. Take the forms that can't be understood, particularly the members of the Republican Party who are the ones who don't understand the whole Medicaid dynamic, that share with them what's happening. People who've lost their coverage, they need to know the consequences of their failure to act, and that it actually impacts their constituents, because they seem to not believe us when we tell them. So it would be very helpful and powerful. Phone calls, if somebody's close by, and if we who are doing this work can help people do that and feel comfortable with it, it'd be really helpful. And the second part is, since there's been so much work from ACA and DCF on determining who they project are not going to be eligible anymore, I guess they must have that information and what the income levels are. And maybe this is already happening, but it would also be very powerful if we had numbers on how many people are below 100% of poverty, so that helps on our expansion issue with actual numbers that they have seen along with the ones they haven't. As y'all are doing your work and coming across this, just keep in mind that it's very powerful when legislators hear it from you and see the information. Thank you.
No, that's a great point, Karen. I think there were, DCF said there were 900,000 people they were anticipating who were not eligible anymore. We're planning on kicking them off. And the question is, I shared earlier that there's 400,000, almost 500,000 Floridians in that coverage gap. And I just can't see how that number hasn't gone up. So we'll see how much of that 900,000 are people who are firmly in the coverage gap now.
And we have been asking them for breakdowns of those anticipated folks anticipated to be disenrolled by income. So we're hoping to get that from them. I don't think we got it, but you're right. Put some pressure on the legislators to get it from them. Absolutely.
Hi everyone, thank you for being here. Allison, you mentioned that DCF has an outdated system. I was told like maybe 4 months ago, about 4 or 5 months ago, that they were trying to update their system. Did you hear anything about that?
Well, I don't think they're updating their entire computer system. I think they're making the changes to it that they can. My understanding is they're not buying like a whole new hardware system, but
That's what I was told.
you were told that?
Yes,
Oh, well,
yes,
that's
yes.
news to me, and I welcome that news. What we were hearing was sort of a lot of tinkering with like the system they had, but that's great.
Okay, and I have a follow-up with the navigators and CACs. With the redetermination, thank you. Letters that are being sent out, are they receiving a link at the bottom to find help or to connect to? No, okay.
Well, they are redirecting people to the Department of Financial Services website. Have seen that letter?
I haven't seen that.
It was proposed that they were gonna add that information to the Department of Financial Services website. From the perspective that I have, that information would not have been very productive for families, because it's just a list of people's names, a long list, not really organized very well. So there wasn't a lot of hope around that occurring. If it is there, I don't know that it's going to be something that families find on page 8 at the bottom. So at this point, there's not really been a concerted effort to use us.
What I will add is that in the midst of all of this, Department of Children and Families is revising their community partner network. So we were fortunate enough to be relisted as a community partner, but I know at times folks get continuously referred to a community partner for assistance.
And can I mention one other thing? In the notices, we worked really hard to get them to include a referral to legal services in their notices. Unfortunately, the link that they included is not a great link, and the phone number they included is to the Access hotline, which, despite the fact that they recently said that the average call time is 10 minutes, in fact, the average call time is hours. I'm guessing by average, they're including all those people for whom the call time was 0 minutes because they hung up. But the folks who are calling the DCF hotline are waiting on hold for hours. So that's been a huge source of frustration for navigators, for advocates, for enrollees themselves to get information.
Scott, we have a question from someone who's watching us on our webinar.
Okay.
Ooh, webinar question. Okay.
So hold on.
This is from Kirsten Lodge, and Kirsten's asking, with the number of procedural terminations, are you seeing anything that could indicate how those cases are being prioritized as new applications are coming through?
That's a great question, but I don't think we've heard anything about that.
Okay,
But
thank
I will
you.
say, just to that point, if someone is procedurally terminated, they do have 90 days from the point of termination to try and comply with the document requests, etc. The challenge there, of course, is maybe they don't find out that they were, I mean, now we're still, it's less than 90 days since the terminations have started, but for those people who are going to be experiencing this in October, they may not walk into a vet's clinic until 95 days after they were terminated. So that's not going to work for everyone.
I know we had a question up here, but I see the mic's back here. So
Yes, I want to say first, thank you so very much for having me here. I'm learning a lot. And you spoke about the people with redetermination, about not understanding the language of the papers from the house. I also want to speak about people with disabilities that don't know to read, write, to use the computer, email, etc. This is also a very big problem for redetermination. I have 2 kids with disabilities and autism, and my older son just turned 18 last year, and he has now been, or in the process of being redetermined, because apparently autism has moved away when he turned 18. And they told in a letter that he will be kicked off if I don't give the doctor's information, and he don't want to go see a doctor now that he's 18. So it's a very big process because I don't have legal rights to him anymore because he is 18. So I can't go into the doctor's office with him because he speaks slow and 18. So this is a very big problem that we are having to be redetermined. Thank you very much for your time, and wish everybody good luck.
Great. So I would say that that situation highlights the benefit of having boots on the ground, making sure that folks know that if I go to this location, I will receive in-person assistance. I know that my access system is out there, and it's definitely not a perfect system, and it helps a lot of consumers, but by having someone that is there in front of you who is a subject matter expert, it can definitely make a difference in having that family have a final redetermination faster.
I agree with that. I think that it really underlines the need to have people in the community providing this type of assistance. There's all different types of publicly funded healthcare programs that we provide assistance with. And in every one of those cases where we're helping people, whether it be the health insurance marketplace or Florida Kid Care or Medicaid or Hillsborough County Healthcare Plan, there is a huge benefit with having someone that is trusted and unbiased, helping people understand the letters, what the application is, because we do it every single day, year in, year out. So I fully agree with you.
Can I, one more comment on that, which is that the work that folks are doing is so important in terms of meeting people where they are. When we had our meeting in Tampa in January, we heard from one of the people in the room who worked at a clinic, and he mentioned how in their clinic they had 3 laptops available for folks for their patients to use to log into My Access, whether that was assisted or unassisted by their staff. But not everyone has a computer, not everyone has good Wi-Fi access. So providing those services and giving people those kinds of resources can also be hugely important.
And before we go to our next question, just to say thank you again for being here and for sharing that story, because it's the nuance in those stories that show you, right, that these big systems aren't designed to catch everyone and all the situations that might come up. So just appreciate you taking the time to share that with us. Then we had a question over here. And then...
Quick comment. Storm Dillon with the American Cancer Society Cancer Action Network. My team and I are lucky enough to live in this situation every day where we deal with public policy and legislation in Tallahassee every day. But it goes without saying, to comment on what Ms. Karen said a little earlier about talking to your legislators and things of that nature. For new people, that is a very intimidating process, no matter what language you speak. And it's harder, I would imagine it's harder, if you don't speak English. So if your organizations have the capacity to sit in the back of the room or be on the phone with these individuals while they are talking, that eliminates so much stress for individuals who are new at this, that think that the golden pants that our legislators put on every day are quite different from the denim ones that everybody else puts on. So I know it goes without saying, I know the opportunity is always there, but if you guys have the opportunity to sit with whatever population you work with and serve, just to be there as a comfort blanket for them, a lot more progress gets made. And that's all I want to bring.
That's awesome. Great point. Thank you. Jody?
No?
Go for it.
I actually just wanted to hear from each one of you. The one thing, and I know there's many, so I'm just asking. Oh. I was confident that I'm loud enough. And I think most people know me.
It's for the weather.
For the weather. Oh, for the webinar, okay. So, what is the one thing that you would say that Florida needs to do to ensure the least amount of people are losing coverage?
I can only say so much as a healthcare provider because we serve folks from all walks of life, especially those that may disagree with our policy positions. But what I would say is continuing the conversation on expanding access to care. That certainly makes a difference in the ability of us as an organization to provide high quality care. At the federal level, there's a big discussion right now on 340B funding. 340B funding, what it does is not only does it provide a discounted rate on prescriptions for our patients, but it also allows us to take those savings and apply it to operational expenses. And unfortunately, that program is at risk right now as we speak. So that is one policy area that we as an organization are continuously advocating for.
So we're a nonprofit that is supported by federal, state, and local funding to provide application assistance for people in the places that they're going to be at. So what I will say is that we are always going to be championing access to healthcare coverage through the programs that are available. And I think, like Javette said, continuing the conversation on ways that we can ensure that that access is available in any way, shape, or form.
I'm gonna cheat and say 2.
I said I'm going to cheat and say
Say 2.
this is very spotty. Can you hear me?
Yes.
Okay. So first, I would say immediately a handful of us, at this point,
with many.
thank you. Many of us have called in a letter that was sent last week, earlier this week, to the state, called on the state to pause the process based on the numbers that came out last week. Our friends at Florida Policy Institute, Erica Lee, thank you very much, took the initiative on that, and many of us have signed on. And we're saying to the state, this process is not going as it should. If we're seeing 80% of terminations were procedural, there's something wrong. The rates in other states are far lower than that. So we know that this is an aberrational number. It shouldn't be this high. So let's pause and figure out what's not working, tinker as we can, wait for that new hardware system, and proceed when we're ready and sure that the damage is going to be significantly less. I would also say, because I can, Medicaid expansion. Florida is, as Karen said, one of 10 states now that has not expanded Medicaid. That's not acceptable, folks. Everyone in this room knows that. We are all fighting like health, as Scott loves to say, to change that. But if we were an expansion state, and for all those lucky 40 states that are, a lot fewer folks would be losing coverage right now because we'd be covering everyone up to 138% of the federal poverty level. I should say caveat because we don't say it enough, who meets immigration requirements. So I think that is really our North Star in changing access to care and coverage in Florida.
Given what I've heard thus far, attorneys reading letters from, I guess, DCF, Central, and cannot understand what are the sequence of steps to take. Do we have a movement for probably developing some clearer communications, written communication that is, that maybe we can run in a few of the newspapers around the state, so that the writers of these letters can think about how you frame ideas. I'm pretty sure somebody has a master's or PhD in English. It's ridiculous that a communication modality that clearly is targeted for either reaching a certain population, and it's confusing. How do we expect to get results if the JDs cannot understand? What's the plan so that clearer letters are issued? And if somebody doesn't want to listen to you, run a couple models in the newspaper.
So, I don't necessarily have the ability to give the feedback about the letters directly or in a way that perhaps we've seen that's made a huge impact. But what we have done at the local level with our community partners is to try to champion some very clear messaging for them to then relay to the families that they also serve. So just really 3 strong bullet points: update your contact information with DCF, be on the lookout for a letter with a yellow stripe, respond to those letters as soon as they're received. And so for the parts of, for local community nonprofits, hospital systems, clinics that we work with, that messaging has been reiterated throughout all of the families they serve. So unfortunately, that is within the purview of the scope of work that we have. I wish I could do an edit in some of the state agency letters sometimes, but we're working with the resources that we have available.
I will add, we're thinking about that as a press strategy now, because I was just saying that to one of my colleagues the other day. We just need to read some of these letters or share some of these letters with some of these reporters, because they are on their face ridiculously confusing. And I think you're right, that just needs to be seen. But again, it sounds like from the state's perspective, they're waiting on that new computer.
Hi everybody, I'm Amanda Patashkin. I'm with Community Catalyst. We're a national organization that works with many of the workers here today. And I just wanted to go back to Jody's point and what everyone on the panel has said about Medicaid expansion, right? And I know tomorrow we have a wonderful speaker that will be here from North Carolina, but just wanted to say that what North Carolina as a state is doing is they are delaying their redeterminations for the people that they believe will be eligible for expansion, so that they will not lose coverage in the time for expansion to go into effect. that can happen. That's a thing that can happen. The state can decide that. I also think South Dakota is already terminating people and they're starting their expansion, so they're an example of not doing that well. However, again, this can be something that if we were able to get Medicaid expansion in the state of Florida, we could strategically decide when people are determined so that they could then roll into a program and not have to roll off. So I just wanted to put that out there and a plug for tomorrow because I know everyone's excited to hear about North Carolina's success. It can happen other places, and I look forward to having you here in Florida.
Thank you so much. And as I think we're getting close to time, so we'll close out. Just wanted to ask our panelists one last question. We talked a lot about different stories and data that has been relevant to this conversation. So for folks who are out of the communities, meeting people, working in one space or another, how should they be keeping track of some of these stories, both specific stories and larger trends? And is there a place where they can connect to? Is that with you guys? Is there a larger coalition? What's the best way to kind of plug into the work that's happening around the public health emergency online?
Thanks, Scott. So a group of us for Policy Institute, Florida Voices for Health, FHJP, Catalyst Miami, apologies if I'm forgetting anyone, have been putting together some resources for folks around the state. Oh, Jody, of course, at USF, have been putting together resources for folks around the state to give feedback. So we're creating a form that will probably live on all of our websites very, very soon. I'm sorry it's not up today, so we can share it with you. But it's going to be precisely that. It's going to, for folks who are working with patients, clients, let us know what you're seeing, what's the challenge, what happened. We're going to make it really simple with a little drop-down menu, properly terminated, whatever, never received a notice. And then we're going to be collecting that data. Until that time comes, feel free to email any of us whose email address you have, and we can share those later. But we do want to know those, and we are going to be continue to systematically relay that information to the state. And also, we're going to be getting a statewide listserv up and running. It's had some technical challenges, but that's going to be up and running also probably within the next week.
I'm going to go ahead and do a plug for Florida Voices for Health. They have done an amazing job. So they have done an amazing job for Family Healthcare Foundation's story banking and collection project. So they are, with the help of our navigators, so they've got a great story. They helped a family. The family says, yeah, I want to share my story. This is great. So they just pop on over to Florida Voices for Health website, and they do a little data entry, and they get the story of the family. And then they have Florida Voices for Health story banker will follow up with the family to kind of get more details, even some videos. And it's just been this amazing resource for our organization to help amplify the work of our navigators and our team members in sharing what the work we do looks like and who it's helping. So it's an amazing project. I'm so proud to be working with Florida Voices for Health in that way, and it's just awesome. And if you're considering doing it, I cannot suggest it enough.
Ditto. What she said.
But I will say, of course, utilize the websites and the processes that both Allison and Katie mentioned. But I will actually encourage organizations that are here in the room, help us spread awareness of the Medicaid unwinding, help us get connected to folks so that not only can we document those stories that are happening out there in the field, but we can actually assist those folks in getting Medicaid and the health insurance marketplace as well.
Awesome. I really want to thank our three panelists. You can see just how expert they are and how much we learned from this session. So I really appreciate all of you for asking questions and being interactive, and our three panelists for crushing that discussion. So next we're going to head to lunch. We'll give you guys a little break. I know we're only a few minutes behind, but we kind of anticipated this. So we built in a few minutes of buffer. So we'll just give you a couple minutes to unwind a little bit in a different way. And lunch will be out in just 10 minutes or so, and